So the reason I'm here today to speak to you is to give you an update on the CCR, which is the Centre for Clinical and Care Research for the NCA. My role is I'm a half-time clinical research fellow for the centre, along with some other people who also work there, which I'll go through in a minute. So really, some of you may have heard about the centre already. So this is an update, but I am sort of assuming that some of you may not know anything about it. So I am starting almost from at the beginning of the story. So first of all, some background to the centre. So you can see here on the left of the slide, the NCA research and innovation strategy from 2022 to 27, and the vision. And I've just focused in on the vision, which you still may not be able to see too well, but basically it says we'll develop assets to support integration of each place and deliver increased number of research and innovation activities. And then you move along, there'll be an increased focus on developing research opportunities and the research skills of nurses, midwives and allied health professionals alongside pharmacists and healthcare scientists who haven't traditionally been involved in research or led research. So part of the vision, and that's the focus. And so that's what has led to the Centre for Clinical and Care Research, and that's the remit of the centre. So some of you may have seen this slide before, and it's focusing on sort of what almost the four core roles of the centre are. So in no particular order, there's providing mentorship and support, and I'll go into a little bit more detail with each of these. So there's some examples there. There's developing people's research skills, so providing invent the wheel if there's other good resources, but sometimes it's a bit of a circumstances, so we help with that. Career pathways from people starting with just a little idea of is research for me to postdoc, and otherwise hopefully we can help those pathways in the careers that we've mentioned. And then obviously there's talent spotting, is really bringing people on who have got a real sort of feeling for research but perhaps haven't had that developed before. So talking about the progress to date, which is really what the whole purpose of this presentation is just focusing first of all on the Centre for the research. So it's actually been set up. So we've got our branding. So this is the logo that you can see there. And then what we have is a web page, and the web page can be found on the Research and Innovation main web page. So I'm not sure if you can see my cursor, but this is the main web page that you can find on a tab on the NCA intranet, and then here we are as the second one in, and you click on there, and this is what you will be seeing. Obviously these pictures, these lovely smiley people being involved in research, that's what happens when you're involved in research, smiley people, and you have training and other information. And then the team for the CCR. So this is just to give you a little bit of an update, and this may be new to even the people who have known about the CCR. So the lead is Professor Heather Al-Smith. Her background is in nursing, and she's a professor of nursing, and you can see here that her research interests, and she's half-time NCA funded and half-time University of Salford. And that's Heather here. And then here we have Helen Hurst, who's a nurse consultant in the renal specialty, and she's one of the clinical research fellows that, like myself, to help promote research capacity and capability, and is working half for the NCA, and then she's also half for the University of Salford. Then here we have Claire Howard, who's an orthoptist by profession, and her specialism is as a stroke visual field researcher, and she's 0.6 supporting the CCR, and then she's 0.4 in clinical practice. Then there's Debbie Antcliffe, who I've seen on the call, who's a physiotherapist by background, a pain researcher, and she's got a little bit of a split role. So she's doing her own research for the NCA 0.6 whole time. She's supporting the CCR for a day a week, and then she's a day a week clinical practice. Then there's myself. I'm a dietetic, the dietetic manager at Salford Royal. And so I'm a little different from the other people in the team because I'm coming with sort of the management hat on. But my specialism is food allergy, and I've done research in food allergy. And so I'm a half and half split between the supporting the NCA and then my previous role of management with some clinical practice in there as well. And then we've got, this is me. And then here we've got Kirsty Marshall, who's a district nurse lecturer and a research into the integrated care system. So she's split between the University of Salford as a lecturer and supporting, I'm working with the NCA, supporting the CCR, but also Rochdale Care Org, integrated care system, and looking at that. So the progress with that, so that was the centre. So then further progress to date, where we've got to. So where we've got to with the talent spotting. Well, we've set up a database and it's for all levels of engagement. Where anybody who we get in touch with, if they're happy, we ask them to put their details into the database. And so it keeps as an idea of who is interested in research at whatever level and what engagement, and also what support they have and where they're up to with their research career. Then we're capturing health and care professions publications across the NCA. This is useful as well as helping raise the awareness of research amongst non-medics, is the quick way to say it, within the organisation. It helps to network and other things. And then we've had some engagement events already. So the official launch date of the CCR was event was in June 2022, even though actually the first unofficial event for the CCR was in May 2021. So we had a launch event. It was at Salford in the Mayo building, and we've also supported some other R&I engagement events, and we've had an engagement event in Bury in November. We've got one booked for Salford already, so put this date in your diary if you can come, if you want to be able to come and chat to us face to face. So the 17th of March in the Mayo building between 10 and 12. And then we're in the process of organising something for Oldham. The other thing we've done for engagement events is a new thing that first one is in a couple of weeks. So it's what we've called a thinking hub, and it's for anything, all things research, really. So it can be any questions. So how to get started, any research ideas, what you do with them. One of the problems I have is that I have all of these ideas that ping into my head, and sometimes they make no sense, and sometimes with some help from others we can make some sense out of them, and that's something that maybe a thinking hub can do. And I'm sure we all know that when actually you get together, you can come up with ideas and networking and really progress any little nuggets of ideas that we've got. But also we can talk about maybe what funding's available for the stage that you're in, and also just to come and say hi to the team. They're virtual events, but we'll still be there, and we can have a good chat. And the plan is that it's going to be the first Wednesday of every other month, from noon to 1 p.m, and it starts on the 1st of February. These slides will be available, and as I said, the session's being recorded. So if you copy that short URL into the browser, that will get you the link into the thinking hubs, which will be promoted again and wider. So progress to date otherwise is, so we've talked about talent spotting, so the mentorship and support. We're providing individual support for researchers at all stages of their journey. I'll go into that in a bit more detail in a minute. We support the preparation of applications again for any level, so for internships or even postdoc applications to the NIHR or other external funding bodies. providing mock interviews, because sometimes when you're on your road to research, you may not have had that sort of interview, and so many of the people in the team have had experience of that, so we can help provide mock interviews. So I thought it'd be interesting to maybe just briefly, I'm trying to keep an eye on the time, to talk about some of the support examples that we've done. And so I'll just go through a few of these. So the first one, a nurse had gained some monies for research sort of on her own initiative from a charity that she worked with. But then the idea that she had in the application that got her some funding, she then wasn't quite clear on how to progress this into actual research. So she reached out to the research team, the CCR team, and one of the team members met with her and discussed possible options that she could do, and signposted to relevant services like the research design, the RDS, to help design a questionnaire and how to the best way to disseminate this. And those support meetings are ongoing as and when needed by the nurse. Another thing that we do, an orthotist was interested in research but had no project or idea, so wanted to be involved in research but really didn't know where to start. And so they some of the internships that are available are a great way for nurturing people who are interested in doing research but in a way don't almost know what a research idea is. So they were supported to apply for an NIHR internship. That's just the National Institute of Health Research organisation. Lots of people have internships, and that's something that we can help you with to navigate at CCR. But they were successful in that, and so now they're being supported through that internship. And the internship in itself is giving training on research concepts, but also perhaps putting ideas together, and really just supporting somebody in their progressions to, is research for them or not? How is it? What's the best way? And then there will be, and this team member really enjoyed the internship, and so they're now wondering what applications they can do to continue on their research journey. Then one of our team provided support to a physio with their application to the NIHR Research Scholars Programme. The support provided was reviewing the application, writing a support statement that was from the NCA, and also undertaking mock interviews. Something else is there was the support for a dietitian who had a research idea and a plan, but really needed to identify some funding to support undertaking this. So some suitable funding has been identified that would fit the plan and the idea, and support has been supported with the application, and that's been submitted, and fingers crossed that will be successful. And then the CCR itself has put together some internship opportunities for staff within the NCA, and this is to gain research experience and exposure. And it's two. One is the study that Heather leads on, which is the Ewing-Conti research study, and also the study that's being led with the taper pain, and we put out calls for applications, and this is something that is an in-house way of supporting the development of people. It is research for them. What does it look like in day-to-day practice? And then there's been support to a community team on its different operational options. So the community team had wanted to be engaged and had got engaged in a multi-centre study. And so there was funding, external funding coming in to provide support and for staffing, but it was how to acknowledge how to actually develop that and to deliver that. So we were able to chat with the managers as to different options. Do you do job shares? Do you do NHSP? Do you do overtime? And those different options of actually providing the service once you've got some of the money to do so. Then we've given support in writing papers for publication, and one was published this month, and that's been done particularly. That was I can't remember the topic of it. I didn't write it down. I can let somebody know at the end of the presentation. And then almost the other end of the support, people with doctoral applications. So we've provided support with preparing an application, reviewing drafts, being the named clinical academic mentor, and really giving advice on presentations for the interview. And I hope that didn't sort of sound like a shopping list of things that we've done. This is just an example of sort of the support that we're doing under the banner of the CCR. And obviously we're still relatively quite new. Lots of us have we haven't been in post. I started in post in September, and Claire has just started in January, and the others have sort of been in between. So we're definitely developing the service, but you can see that we're trying to provide support in a wide range of settings. So another sort of heading as to what we're trying to work towards to help the research capability and capacity is the development of a journal club, and that one of these is already happening, and then advertise these internship opportunities, because sometimes it's quite hard to know what's coming out when, and people can miss the boat. So really proactively, with the help of the R&I team and Claire Mooney in particular, thank you Claire, to getting some of these opportunities out there, but also when we chat to people, actually signposting them to something that would be suitable for them. And then we've done a programme of research skills training. So if you can see the little picture I put on the side of the slide is actually what it looks like on our web page that I pointed you to earlier. But we've already delivered how to write for a publication, how to search the literature, and that's been with support of the library services, and how to develop a research question, and then what's coming up we've got, and all of those are still available. So if you click on, and that's why I did the click for the web page, you can click on and you can see those via YouTube links. And then things that are planned for 2023, how to develop your clinical academic profile, how do you undertake any reviews, scoping or systematic or somewhere in between even, what personal funding opportunities they are, what do all of these abbreviations mean, which ones are for you, how do you access them, what's suitable, and then talking about patient-public involvement and engagement, which is really important in any research, because we need to remember in clinical and care research, where the aim is ultimately to improve care for our patients. And then finally, the career pathways. So we've been basically engaging with sort of clinical and service managers, and promoting sort of research as being a career pathway, which often isn't thought about, educating some managers and other higher up people within professions to highlight that the options that it can research, but also research doesn't have to be either or clinical or research. There's lots of different ways that we can do that, and we're trying to problem solve, because this is a new service, it's a new centre, and we're often being asked things that we may not already know the answer to, but we hopefully can go away and do some research of ourselves and provide that for the people who've come to see us. So this is just, I don't expect you necessarily to see this, but these are the strategic aims and objectives that the CCR has. And basically, the first one, you can see it was to establish the CCR. The second is the talent spotting. The third, the mentorship. So this ties up with the logo that you've just been happening. So that is a really quick skip through the work of the CCR, and how it's got a central role in delivering the aim and the research strategy for the NCA in really increasing capacity and capability in nurses, midwives, AHPs, health scientists and pharmacists. So that's the end of the presentation. I've left a little time for any questions, if there are any,